Hello, I am Dr. Vijay Deshmukh, founder of Smilex, practicing dental implant for more than 30 years. This question is asked most of the patient. Doctor, why does the dental implant fail? If it is so expensive, if it is so technologically advanced, why it should fail? So most of the time, the dental implant is not failing. Someone is failing in taking care of that implant. So today the success rate of implant is 98 to 99%. So that is very high in the terms of medical success rate if you consider. So 98 to 99% documented success rate. At Smilex we do implants at a 99% success rate, very high, because of our extremely careful observation of the cases, the technology what we select for placing the implant, the type of implant, the type of the crowns we made, the laboratory support, and the post-operative care what we ask the patient to take. So typically there are reasons why the implants fail. Even though the success rate is 99%, that 1% category, what is the problem? Why does this implant fail? This implant fail because of the most important reason is, the number one reason is the if you don't take good care, you don't take good hygiene care, then this implant fail. The second reason why this implant fail is the patient having the micromobility of the abutment. Micromobility means the implant is stable but the cap has become loose, and you don't go to the doctor after the implant. Then that implant can fail because implant doesn't like micro movement. It needs a rigid fixation of the crown on the top of the implant. If there is a screw which has gone loose, then the implant can fail. Then most of the time, if there is immediate failure of the implant, like doctor has placed the implant and within 8 days or a month or 2 months the implant has just failed. So this is typically seen when there is a necrosis of bone around the implant, means the bone around the implant is not healthy. This can happen because of the two reasons. One, the kind of torque, the pressure, it's called pressure necrosis. The pressure necrosis can just destroy the bone around the implant. And the second reason, there are chances that you're undergone root canal treatment and there is already the bone which is little infected inside your healthy bone. So there is a healthy bone, but there are small islands where the bone is little diseased, and the infection is set there inside the bone. And we see such kind of patients. Sometimes, very rarely, the implant really fails within no time, right? So pressure necrosis as well as the residual infection from the past dental root canal treatment or etc. can also cause the immediate failure of the implant. So the reason now common implant late failure after 5 years or 10 years is what we see typically if you're not taken a good care, if the hygiene habits are not good. And then there is an infection around the implant. That infection can go inside the gums and it start destroying the bone around the implant, and then the implant can fail. That is called peri-implantitis, so which is very commonly seen. So implants can fail for multiple reasons. It's a medical procedure, definitely, right? And definitely a doctor can take good care, and definitely your commitment is also there to take good care of the implant. And if the good care is taken, the implant can work in your mouth for long. So I'm practicing for last 30 to 33 years, and I see my 25-year-old patients sometimes, and their implants are still working. So implants are designed to work for longest possible time, provided a good care has been taken, provided a good implant has been selected, provided a good crown is selected, provided you selected a good doctor, a center of excellence where implant procedure is very routine. So don't select a center which has just started. Don't select and go to a doctor who is doing sometimes the implant. It's not safer, right? You should go to a center of excellence of implant where things are happening routinely. Every morning they have surgery. Like at Smilex, we got couple of chairs only dedicated for number of implants we do. So there are specialists involved. I'm like an implant surgeon. It's implant restorative. So it's a team which is saying. So if you go to a good center of excellence, possibly you will have a very success rate, very high success rate, and the implants will not. So selection is very important. Take decisions very cautiously, study everything properly, and then go for your dental implants. Don't take a short term or shortcut to the success. You have to always do nice observation, nice study, and then make a decision to go for dental implants. Thank you for watching Smilex.